I personally, I have been threatened, like threatened, my own life being threatened, or threatened with so many things, just because they feel, oh, I'm the weaker vessel in that sense. Hello, my Red Tribe, and welcome to another episode of Dr Red Diaries. First of all, we all know that we're in the month of March, and this is Women's Health Month. So we'll be talking a lot about women. So if you're a man and you're not interested in hearing about women, scroll over. But however, this month is very important for everyone, for both men, but for both women, married, unmarried, for us to learn and really talk about some of the challenges and things that we get to deal with as women every single day regarding our health. So for today's topic is actually very personal to me because it's one of my most common struggles. It's about being a woman in the healthcare system. Whether you're a doctor, you're a nurse, a patient, a caregiver, or simply someone trying to be heard as a woman, this one is very, very close to my heart. So let's start. I remember in my early days, my medical journey, working into a ward round. Let me even start with that. And then confidently prepared, ready, and someone asked, "Oh, are you the nurse?" I was wearing my full regalia with the ward coats and so on and so forth. Again, let me say this clearly: nurses are incredible, and definitely they are the backbone of the healthcare system. But in my head, I was thinking the number of years and every single thing I went through as a medical doctor. How did you come to that conclusion that I'm a nurse? And over the years, I came to realize that it's something that most people do in Nigeria, where if they see any lady or any woman in the healthcare system, they just automatically assume that that lady is a nurse. That's one. Now let's talk about dealing with either harassment or dealing with any form of inconvenience as a female medical doctor in Nigeria. There are several times over the years in my medical experience, I have to deal with proving myself as a medical doctor. I'll get questions like, "Oh, are you sure you're the one in charge? Are you sure you know what you're doing? Are you not too young? You're too soft. You're too emotional," even when I'm not showing any form of emotions. So then you now have to adjust yourself and or adjust your emotion just to cater to people not asking you certain questions. And then you hear things like, "Oh, you are too rigid, you are too rude, you are too," so many things. So the question now comes in, where is now that balance? How do we get to, as female, as women in the healthcare system, how do we balance ourselves? How do we present ourselves to the world so we are not judged for it, we're not criticized for it, we're not scrutinized for it? It is a major challenge. And bear in mind that as women in healthcare, we also deal with most challenges I feel like most other women deal with, if not worse, if not more than others in other fields. Why? Because there are several times I have been threatened, like threatened, my own life being threatened, or threatened with so many things, just because they feel, oh, I'm the weaker vessel in that sense. So in this month of March, it's important for us women in the healthcare system to remember that, number one, nobody can drown our voice. Nobody can tell us who we are not, or even tell us who we are. So we are the ones to speak up. We are the ones to own our voice. We are the ones to stand our ground and make sure everybody knows and everybody is aware of who we are in the healthcare system. And another thing I also want to say to women is that we need to start taking up more leadership role in the healthcare system. in the last few months, this 2026, from January till date, we've been hearing about so many things that are happening to women, even women either not in the healthcare space or even in the healthcare space. And one of the things that keeps crossing my mind is, how do we get women to take ownership in the sense that to start taking up more leadership roles? Most in the healthcare system, for example, if you look at the list of people in the committee or the stakeholder, they are mostly men. In fact, 90% are men. I have been to meetings where we are like just two women. I'm even the youngest. If you're in a meeting of 20 people, imagine 18 people being men and you being the youngest. So it's always difficult you have to now push yourself and try to get your voice to be heard at that particular time. So I'm saying this because I think in 2026, I want more women, especially in the healthcare system, we need to step up. We need to take ownership. We need to start taking on more leadership role in all areas and all spheres of our lives. We need to come out and speak about the challenges that we face also as women in the healthcare system. We need to talk about how the healthcare system is not really favorable to the Nigerian woman and the things that we can do. Because imagine a man trying to dictate how a woman, in that sense, how a woman is supposed to act or behave, or trying to talk about certain things that only a woman would understand. So that's what I'm trying to say. That's one. And also, we need our voices to be heard at this table where important decisions are being made, especially in the healthcare system. That will enable, whenever policies are passed, whenever decisions are made, we are not sitting at the back and saying, oh, well, they make decision. No, we have to be part of the people making this decision. It is very, very important. So in this month of March, if you are in the healthcare space or in the healthcare system, I am calling on you to start making your voice heard in the hospital where you work, in the healthcare center where you work, if you're in the health insurance space, in the health insurance company where you work, wherever you are, make your voice known. Start making that decision to take up leadership role. Stand strong on what you believe and don't allow anybody actually drown your voice. Thank you for watching. I'll see you guys in my next video.